Every single night, you close your eyes, roll onto your side, and drift off to sleep. You don't think about it, nobody does. It feels completely harmless. Just a slow, silent pressure building night after night that your heart after 65 is no longer as equipped to handle as it once was. Theory. This is something cardiologists have been paying close attention to, and the research behind it is something every adult over 60 deserves to understand. Stay with me through this entire video, because at the end, I am going to give you the exact sleeping position that cardiologists now recommend for adults over 65. And I will explain precisely why one common position may be doing more damage than you realize, especially if you already have high.
My name is Dr. David Lee, and I do one thing. I take complex medical research and translate it.
No unnecessary alarm, no exaggeration, just the evidence and what it means for your daily life. Today's topic is one that almost never comes up in a doctor's appointment because it happens while you are asleep. And yet sleep position is one of the most underrated factors in cardiovascular health after 65. We dive in, Before we get to the specific position, I need to give you one foundational concept, because without it, what I am about to say will not fully land. Most people think sleep is when the heart completely rests. That is partially true, but the full picture is more complicated. But here's what changes after 65. Your heart muscle becomes slightly stiffer with age. The valves do not operate with the same flexibility they had at 45. Blood vessels lose some elasticity. And the autonomic nervous system, the system that regulates your heart rate during sleep, what this means in practical terms, your heart after 65 is more sensitive to positional pressure, more sensitive. And the position you sleep in directly affects how hard your heart has to work while you rest. Let me tell you about Harold. Harold was 68 years old, a retired fighter from Michigan, strong, active, and sharp. He started waking up in the middle of the night with a dull, uncomfortable pressure in his chest. Not pain exactly, just pressure. He mentioned it to his wife, who urged him to see his doctor. His cardiologist ran a full evaluation and found something Harold had never connected to his sleeping position. Mild but consistent acid reflux was aggravating a pre-existing heart arrhythmia, and both were being directly worsened by the position his body spent. His cardiologist made one recommendation before changing any medication: change your sleep position. Within 3 weeks, Harold's story opens a door to something important that I want to walk you through carefully. Let's talk about right side sleeping. This is the position that most people naturally default to, and for many years it was considered perfectly neutral. Point 1, the heart position effect. When you lie on your right side, your heart, which sits slightly left of center in your chest, rotates. This subtle shift can alter the electrical conduction patterns in the heart. Multiple studies have found that right side sleeping is associated. For someone with atrial fibrillation, one of the most common heart conditions in adults over 65, right side sleeping may trigger more frequent, irregular. Point 2, the acid reflux connection to heart health. This one surprises people. When you lie on your right side, the stomach tilts in a way that looks. Chronic acid reflux during sleep is not just uncomfortable. Research has found a direct connection between esophageal acid exposure and vapors. In older adults where the autonomic system is already less precise, this nightly acid nerve stimulation can contribute to irregular heart rate. When you sleep on your right side for extended periods, you are working slightly against the natural direction of lymphatic drainage. Over time, across years of right side sleeping, this can contribute to sluggish lymphatic function and increased systemic inflammation. Now, here is where it gets even more interesting, because I have not told you yet which position cardiologists actually recommend. Before I give you the recommended position, let us address back sleeping, because many people switch to back sleeping, but for adults over 65, back sleeping carries its own specific risks that are worth understanding.
Risk 1, sleep apnea worsening. Sleeping flat on your back causes the tongue and soft tissues of the throat to fall backward, narrows.
And sleep apnea in older adults is not just about snoring. Untreated sleep apnea is directly linked to elevated nighttime blood pressure. Risk 2, increased cardiac load in heart failure patients. For seniors with any degree of heart failure, lying completely, this increases the workload on an already stressed heart. Many cardiologists specifically advise heart failure patients to elevate the head of their bed. Risk 3P, lower back and spinal pressure. Flat back sleeping without proper lumbar support places significant strain on the lower spine. The audio features a man speaking confidently and calmly, interspersed with breathing sounds and occasional mouth noises.